Support for Radio Friends comes from Rose Heart Hypnotherapy, serving Central Missouri since 2007. They specialize in pain management, pre- and post-medical procedures, fears, phobias, and increasing performance and success in every area of life. Athletes needing sports hypnosis to improve their ability will be pleased to know that Rose Heart Hypnotherapy specializes in neurofeedback and is the only certified OptiBrain train and golf practitioner in Missouri. Call Rose Heart Hypnotherapy at 888-604-9997 or visit mohyp.com and experience true success. Good morning and welcome to Radio Friends on Friday, June the 8th. It's good to have you here today. And I've got one of my favorite doctors on, Dr. Anand Chockalingam. Good to have you here again, Doctor.
It's wonderful being with you on the show.
A heart doctor. Your motto is smile 20 times an hour. Is that right?
Yes.
Every 3 minutes. Why should we smile 20 times an hour?
I think that is the simplest thing we can do for our health, but the most profound thing also at the same time. So once we smile, we are connecting with our true inner nature, with our subconscious. So we'll perform better, our output will be better in whatever sphere of life we want to pursue. Ultimately, our health is going to be that much better off by taking life easier.
Yes, okay. The other thing we were talking about is the importance of exercising, right?
Excellent.
Exercising makes us feel good, and it does something good for the body.
Definitely. That's one of the main things that we emphasize for the heart health. So I want to touch upon two things: what exercise to do and how to do it. So
Okay.
we'll answer these two simple questions today.
Okay. What exercise you do?
So the couple of things to remember when you think about what exercises to do. Now the emphasis is shifting more and more towards getting high-intensity exercise, which is more than the typical cardio training. In cardio training, what we say is have a warm-up period, reach a modest level, and maintain that for about 20 to 30 minutes, and then do a cool-down phase for another 5 minutes. This is what is typical cardio training.
Mm-hmm.
And this is safe for heart patients also, and we've been doing this for the last 50 years, I would say. But now in the last 5 to 10 years, we are seeing more and more evidence from good studies saying that high-intensity exercise is equally beneficial, maybe even more than the typical cardio training. So what this high intensity is getting to your maximum capacity by walking, running, swimming, cycling, whatever exercise we are doing, pushing your limit. And most people can't do more than 3 to 4 minutes at that level. And then we come down to a very, very modest level for another 4 minutes. Go up again 4 minutes on, 4 minutes off, like that 4 cycles. This adds up to about 25 minutes. What we can do in 2 or 3 sessions of this is a total of about only, I would say, 60 to 80 minutes per week. This is the equivalent of getting a full 150 minutes for a week.
So how do you know, though, if you're pushing yourself too much that you could hurt yourself?
So this, first we have to be confident that the heart is stable. So first I would request people who are older or have risk for heart disease to talk to their regular doctors or consult with a cardiologist to make sure that the heart is good enough at this point to start that type of a burst training. So once we've got the clearance from your doctor, then I would encourage you to slowly try pushing yourself to that full capacity for a few minutes.
To get the clearance from your doctor, would they have to do an EKG to check on you?
Sometimes it's just talking to them or listening to the patient. Sometimes it's a ECG. Sometimes it involves a stress test to be absolutely sure the heart is okay to go through that type of training. And once these tests have been done or a doctor has given the clearance, then I would suggest people to try these types of exercise. The reason I suggest this now is because this cardio type training on slow, modest level and off, that is not how our real life works. When we go to Walmart or when we have to carry groceries or even do some physical work, it doesn't have a warm-up or a cool-off phase.
No, it doesn't have a warm-up.
We just have to do what we have to do. So it is more actually physiological to do what it takes rather than have this tailored programs.
Okay, can a lot of people get the exercise they need by just doing things like working in the yard, working in the garden, cutting the grass, cleaning the house, without having a formal exercise program?
Excellent. You are leading into the next thing. The next thing I wanted to touch upon before I answer your question is about what other type of exercise to do. One is requested people to try this burst exercise. The second request is to try weight training. This is
weight training.
Yes. As a cardiologist, for so many years I have not encouraged people to do this. But now there is more and more evidence saying some amount of modest weight training, muscle building at every age, both for men and women, gives more muscles bulk that's able to burn more calories, gives us more confidence to be able to do our day-to-day things, and actually improves cardiac health also. So it's not just the traditional walking or cycling. Even a little bit of weight training is excellent for upper and lower extremities. So,
and you're never too old for that, right?
Everybody may benefit from it.
And smile while you're doing it.
Excellent. So high-intensity training, weight training, and then we'll move on to what is the right way to approach exercise. So that's where your question comes, whether doing work around the house counts. My request is, if you can do the exercise and not call it an exercise, that's even better.
Yes, yes.
So people who move naturally because their job requires them to do it, or because they enjoy doing some other activity like gardening or playing sports, for instance, these are people who would end up sustaining it over months, over years, and not have to worry about getting one more thing done in their busy days.
I enjoy working in the yard, cutting the grass, working in the garden, and in the fall I cut my own wood to heat the house. Now, I find that fun, and I'm getting exercise at the same time. It's not really a job, it's fun to me.
Excellent.
And that has benefits, right?
This is the best way to exercise. Obviously. The reason is you're doing it year after year. You're not doing it for anybody's sake. You're not doing it for your doctor's sake. This is the ideal way to do it. Have fun. Do what you like to do. More and more of it. As long as it is not, Doc, I enjoy watching television. No, that doesn't count.
No. Yeah.
So, Doc, I like to play chess. That's a game. No. It has to be something physical. As long as it involves our body, that will be ideal. If it's a sport, it's even better because you can participate with friends, family. And if it's gardening, it's also enriching our soul.
Yeah, we don't. I like that. It enriches our soul.
Yeah, definitely.
We don't wear out. We rust out, don't we? We can rust out.
Yeah.
Hey, we're just about out of time, Doctor. We don't want to go over like we did last time because you've got so much information. But you've got family back in India that listen and watch you, right?
My dad is a cardiologist, and he's been talking about the same stress control for the last 50 years.
He's a cardiologist in India, and your mother is a retired
pathologist.
Yeah, and they're listening to you or watching you.
Yes.
Give them a shout out there.
Hi.
Okay. All right, Doctor. From MU Healthcare, please come back again. Excellent. It's always a pleasure visiting with you, and I hope you got the information across that you wanted to today.
Thanks so much for the opportunity.
Dr. Anand Chockalingam, correct?
Yes.
Correct. Okay. He's smiling at me, so I hope so. If there's something you'd like to hear or see, I'd love to hear from you. Drop me an email. That's pepperp@missouri.edu. Remember, go out and smile 20 times an hour or 30 times an hour. As many smiles as you can get in. Bye-bye.
Wonderful. Thank you.